So the SC joint is a tricky joint because it doesn't have a lot of space for you, okay? If you really believe you've got an SC problem, you will feel very little motion that's actually happening at the SC joint. So what you're going to do is you're going to find the SC joint and you're just going to give it a little spring. So I'm giving her a little an AP glide, and then I'm giving her a little inferior glide. I'm just going to see if it moves, okay? It should spring a little bit. If you feel it's just not moving compared to the other side, then you know you have a restriction, okay? A couple things could be restricting that. Because it's so intimately related to the first rib, to T1-2, to the upper trapezius, to the rib cage down below, you're gonna set it up properly through the ribs, then the scapula, and then come to the SC joint. You also have subclavius, okay? Subclavius will go into a big muscle spasm if the shoulder has been under some kind of trauma or immobilized, where then we didn't get that nice rotation for a while, and subclavius will just bound down under there. Okay, we've got great dry needling techniques for subclavius. You can do a soft tissue technique for subclavius getting in here. There's pumping techniques for subclavius. There's so many different subclavius techniques you could do. And I'll usually set it up that way. And then after that, once I release the area, then I'm gonna go and give it a nudge, okay? So you can be right here, thumb over thumb, thumb next to thumb, just one thumb, and you're gonna give it an inferior glide, okay? So the point is to go into the barrier and then to try to oscillate into the barrier, okay? If we think that it's not going posterior to allow for protraction, what we're gonna do is come just right on top. And again, you could go thumb over thumb, or you could go thumb next to thumb and just give it a little bit of a posterior glide. Okay, so it's a sensitive area. Be gentle here. Just engage your barrier, have really good touch under your hands, and just feel these slight little motions, okay? It is not gonna move like a hip joint's gonna move, okay? It's got tons of ligamentous support. It's got a lot of fascial support around it, so it's not meant to be a huge mover, okay? So we've got thumb either next to thumb or thumb over thumb, gently just creating this inferior glide. I can be right on top going into a posterior glide down. And that's really all we need to do for the SC joint, okay? There's lots of cool muscle energy techniques out there. You can get fancy or you can keep it simple, okay? But just know, if you're going to treat, if you feel you've got an SC joint that's blocked, you're going to need to treat around it first. This is not the first thing you're going to treat. You have to release ribs, first rib, T1-2, anywhere in that thoracic spine that's involved in there. You'll want to go after your scapula to get it in the right position, and then come to your SC joint. Okay, so it's down the list. You got your big guys first. Okay. I just recently have a woman who was thrown from a golf cart, and she has a grade 3 AC separation. I think I mentioned that to you last week. And she was immobilized for, 6 weeks. And things were very stiff here. And so finally we got through her T-spine. I started moving scapula, ribs, etc. But her SC joint was completely locked down, which is why we were having trouble getting up here. How can you get up here if the SC joint's not going to do its part? And so finally we needled subclavius. I did some good joint mobilization here, and it came right back. And then we were able to get the arm up. Okay, so it's just a nice little couple techniques for the SC joint. So that's really all you got to practice, is just a little inferior glide Here they've got the hands wrapped around, okay? So you don't need to come into their throat or their neck, making them cough or anything like that. Thumb next to thumb, thumb over thumb are your options. Here's right on top. Again, there's that thumb over thumb technique, okay? All right, so here are the mobilizations you guys probably already